So if we think about some of the challenges that we deal with here in the U.S., do they translate readily into other countries? Oftentimes, no. If we think of our own ethical and religious directives, there's a introductory set of paragraphs that front load beginning of life issues, end of life issues, etc. Those introductory paragraphs are very scripturally based, so they would be equally applicable anywhere. But if we're talking about withholding and withdrawing life-sustaining treatment, it might be very different how those guidelines would play out in a different country. So that, I mean, one of the worst things I think we could do would be to export American bioethics, certainly secular American bioethics, because it was very much a function of the U.S. culture. Some of the important ways that bioethics is different in other countries, one of the statements I made earlier about the respect for vulnerability, that simply wasn't part of the U.S. system. Our privileging autonomy, individual autonomy, doesn't translate into cultures where families make decisions, not individuals. And whereas it might be important to get better gender justice in some of these countries where women aren't the equal as humans of men, we need to be careful about how we export a notion of informed consent and that individualized autonomy. It's also important if we think about the type of honesty and disclosure that we have. If we look at many countries in the South, I've done work in northern Italy, which is different than doing it in southern Italy in terms of the honest disclosure about medical conditions. That's certainly true if you're in Asian countries like Japan, where they're still looking at how much information people want. Should it go to a family member? Should it go to the patient? So I think there are lots of instances where U.S. bioethics doesn't translate readily. We've certainly seen that when we look at the standards for research ethics. And can you simply take U.S. standards and export them? Is it okay to use different standards? There's a lot of debate right now within the bioethics community. I oftentimes, when you think of developing countries, am reminded of two Jesuits that we had studying with us, one from the Philippines and one from Africa. And oftentimes we'd present a challenging case, and they would just say, in my country, we'd never be talking about this because this just wouldn't happen. So as we think about working with people from different cultures and different countries, there's going to need to be some initial groundwork about what are the challenges and what ways are the same and what ways are they different. And I would think also there would need to be a lot of humility that we haven't necessarily solved the problems for the rest of the world. And so as we create this global community, a lot of listening and respect that needs to happen from all sides.